Good afternoon, and thank you for joining us. Today, Dr. Walensky will share the latest on the Omicron variant and discuss how people can stay safe over the holidays. And Dr. Fauci will provide an update on the latest science. First, I want to underscore the president's message yesterday. Due to Omicron, we expect a significant rise in cases. Fully vaccinated people, particularly those with a boost, are highly protected. But due to Omicron's highly transmissible nature, we will see fully vaccinated people get COVID. They'll likely be asymptomatic or feel under the weather for a few days. Let's be clear, unvaccinated people are at a higher risk of getting severely ill from COVID, getting hospitalized, and dying. We are prepared for this moment. Yesterday, the president announced new actions the administration is taking to protect families, communities, and hospitals as we face Omicron. These steps include more support for hospitals, including 1,000 military troops deployed, hundreds of ambulances, and help for hospitals to ensure adequate supplies, equipment, and beds. More testing, including new federal sites, and 500 million tests that will be free to all Americans. And more capacity to get shots in arms, including new mobile clinics, hundreds of additional vaccinators in the field, and tens of thousands of new appointments. Let me reiterate what the president said yesterday. This is not March 2020. We have more tools than ever before to protect people: vaccinations, boosters, testing, and treatments. Today, I want to give an update on treatments. From day one, our strategy has been to fill the nation's medicine cabinet with a diverse set of options to treat people. Let me walk through the three types of treatments, starting with monoclonal antibody treatments, which have proven to be highly effective. Since July, we've deployed 2.7 million monoclonal antibody treatment courses to help keep people out of the hospital and save lives. From the moment we learned of Omicron, we began assessing our existing monoclonal antibody treatments, and we learned that 2 of the 3 existing treatments are not effective against the new variant. Fortunately, GlaxoSmithKline's monoclonal antibody treatment is effective, so we acted quickly to secure more supply of it. We're more than doubling the supply of GSK's monoclonal to more than 1 million treatment courses, with 300,000 treatment courses available in January. And we've already begun making this drug available to every state and territory. Next, let me touch on a preventive treatment from AstraZeneca, which is especially important for certain immunocompromised individuals at high risk. Many of these immunocompromised people are not able to get the level of protection they need from a vaccine alone. We will have more than 500,000 doses of AstraZeneca's monoclonal antibody treatments on hand in January, and we're preparing to purchase significantly more across the next 3 months. And finally, let me provide an update on antivirals. We got good news today with the authorization of Pfizer's antiviral. Merck's pill, if authorized, along with Pfizer's newly authorized pill, add oral treatment options to our nation's medicine cabinet. As soon as emerging science showed the promise of these antivirals, we acted quickly and aggressively to pre-purchase 10 million treatment courses of Pfizer and 3 million courses of Merck. For Merck, by end of January, we anticipate about 3 million treatment courses available to send to states if FDA authorizes. The Pfizer team has a very promising and now authorized treatment, a pill that dramatically reduces the risk of hospitalizations and death for those at risk. We've purchased 10 million courses, more than anyone else in the world. According to Pfizer, the complex chemistry involved in creating the active ingredient in the pill means production takes about 6 to 8 months. So supply of this product will ramp up over the next several months. Knowing that these pills take time to manufacture, Pfizer continues to increase their production plans. And now that the pill is authorized, we'll have discussions to explore how we can help them improve their manufacturing capacity even further by providing any resources needed. We will have 265,000 treatment courses of Pfizer available in January, with monthly totals of pills ramping up across the year and all 10 million treatment courses delivered by late summer. As quickly as Pfizer gets the pills manufactured and delivered, we will immediately provide them to states and jurisdictions for distribution. Just as we've done with vaccines and monoclonal antibody treatments, we will ensure equity is at the center of antiviral distribution. We are not only urging states to ensure equity in their own distribution plans, but we are also distributing antivirals directly to community health centers across the country. This will help ensure these life-saving antivirals are available to the most vulnerable communities and hard-hit populations across the country. In closing, as we face Omicron, the nation's medicine cabinet of treatments gives us more options to protect the American people. It's yet another reason this moment is much different than March 2020. We have tools to keep people safe, and we will continue using them to do so. With that, over to Dr. Walensky.
Thank you, Jeff. Good afternoon. As usual, I'd like to start by walking you through today's data. The current 7-day daily average of cases is about 149,300 cases per day, an increase of about 25% over the previous week. The 7-day average of hospital admissions is about 7,800 per day, and the 7-day average of deaths are about 1,200 per day, which is an increase of about 3.5% over the prior week. Over the past several weeks, CDC has continued to closely monitor the emergence of the Omicron variant. Currently, over 85 countries have detected Omicron, and on Monday, we released updated data for the United States, which estimates that the Omicron variant represents approximately 73% of COVID-19 cases in the United States. And in some areas of the country, Omicron has increased even further, accounting for an estimated 90% of cases in the Eastern Atlantic states, parts of the Midwest, South, and Northern Pacific states. This rapid increase in the proportion of Omicron circulating around the country is similar to what we've seen around the world. Although this is a reminder of continued threat of COVID-19 variants, this increase in Omicron proportion is what we anticipated and what we have been preparing for. I know there are a lot of questions about the Omicron variant, how to protect yourselves, our loved ones, how to safely gather with our families and friends over the holidays. And you've heard me say before, we know what works against COVID-19, and it's critically important that we implement our proven multi-layer prevention strategies. Let me reiterate those 4 prevention measures for you. Get vaccinated, get boosted, wear a mask in public indoor settings in areas of substantial and high-risk community transmission, and take a test before you gather. I know many parents are wondering how they can keep their children safe for the holidays. If your child is 5 or older, get them vaccinated. And if they are younger than 5 years, surround them with adults and siblings who are vaccinated, boosted if eligible, and masking in public indoor settings. I also want to be sure people understand the risks around holiday travel. Holiday gatherings and risk of travel really has less to do with the airplane or car ride and much more to do with how people from different households behave in the weeks to days before meeting up. Importantly, consider gathering with family and friends who are also practicing similar proper prevention measures. And as we have said before, those who remain unvaccinated are the most vulnerable to COVID-19. CDC data now updated through November, when Delta was the predominant strain circulating, demonstrated that an unvaccinated person has a 10 times greater risk of testing positive for COVID-19 and a 20 times greater risk of dying from COVID-19 when compared to those who are fully vaccinated and received their booster dose. Although every day we are following more and more studies emerging about the Omicron variant, early data on the vaccine is promising against Omicron, especially when people are boosted. COVID-19 vaccines, especially when accompanied by a booster dose, are likely to protect against severe disease, hospitalization, and death. Still, we know we will continue to hear more about people who get infected who are vaccinated. These people may get mild or asymptomatic infections and could unknowingly spread those infections to others. Again, this means it is important for everyone, regardless of vaccination status, to wear a mask in public indoor settings in communities of substantial or high transmission. And I would encourage people to take an at-home COVID-19 test ahead of time to help protect you and your family and friends who may be at greater risk of COVID-19 or severe outcomes. Evidence has repeatedly shown that these prevention measures, when layered together, work. So again, if you're wondering how to stay healthy and protect your loved ones this winter, please get vaccinated, get boosted, wear a mask in public indoor settings, and take a COVID-19 test before gathering with others. We're at a critical point, and how well these measures are implemented by all of us, caring for ourselves and for one another, will largely determine the outlook of the coming weeks and months ahead. Thank you. Happy holidays. I'll now turn things over to Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do now is just spend just a few minutes on underscoring and reiterating some of the important principles that Dr. Walensky had mentioned. I'm going to touch on 4 areas very quickly: transmissibility, severity, the evasion of immunity by vaccines, and the potential impact on therapeutics. I will point out that there is a relationship between interpreting the relationship between transmissibility and severity, and I'll explain what I mean in a moment. Next slide. No doubt, this is a highly transmissible infection. These are the latest data that we get from the CDC about the Omicron variant that is sequenced in the United States isolates. It is now about 73+%. And speaking to governors from other regions of the country, in some, they're even as high as 80 to 90%. So there is no doubt that we are dealing with a highly transmissible virus for the reason, as Jeff mentioned just a moment ago, that we expect that there will be continuing to have a substantial increase in cases. Next slide. Now we get to the idea of severity. These are data from our South African colleagues who have clearly been showing now in conversations we've had and now in this recent publication that in fact it appears that in the context of South Africa, there is a decrease in the severity compared to Delta, both in the relationship and ratio between hospitalizations and the number of infections, the duration of hospital stay, and the need for supplemental oxygen therapy. Recently, literally yesterday, there was another paper that came out from Scotland, which appears to validate and verify the data that are in South Africa. This is good news. However, we must wait to see what happens in our own population, which has its own demographic considerations. I would point out that even if you have a diminution in severity, if you have a much larger number of individual cases, the fact that you have so many more cases might actually obviate the effect of it being less severe. And that's one of the reasons why the president, in his remarks yesterday, spoke about how we are going to supplement the capability of hospitals to respond to the possibility that there might be a run on the need for hospitalization. Next slide. Now let's talk about some of the immune evasion. We've mentioned this in different briefings before, but just to reiterate, there's no doubt that there's a marked reduction in neutralizing activity against Omicron when you look at the 2-dose mRNA vaccines, when you compare Omicron to earlier variants such as Delta. However, and here again, why we emphasize the importance of booster shots. The anti-Omicron activity is about 20 to 40-fold higher in sera from boosted vaccinees versus the peak in individuals who had a 2-dose vaccine. This is validated by the clinical data, which shows that the vaccine efficacy, as we all know from previous studies, of a symptomatic infection of a 2-dose mRNA wanes over time. However, there's a moderate to high effectiveness, about 75%, seen in the early period after a booster dose, and very likely higher when it comes to hospitalization and severe disease. Next slide. A quick word now on something that Jeff mentioned, is namely the treatments that are available. Unfortunately, but understandably, with the degree of mutations that we have with Omicron, some of the monoclonal antibodies shown on the slide here very likely will not work against Omicron. And those are shown in the first two under monoclonal antibody. Fortunately, the GSK Vir product, sotrovimab, looks like it is well positioned to be used as a treatment against Omicron. And then the AZ product also is likely. Small molecule antivirals are available now. You heard the recent approval of an EUA of Paxlovid. Of note and underappreciated is remdesivir is already fully approved and is available in a 3-day course, which in a recent study showed to dramatically diminish the need for hospitalization. Guidelines on this will be now re-examined by the NIH Guidelines Committee, and you'll be hearing more about recommendations how to utilize these. If I can have the last slide. I want to again just reiterate what Dr. Walensky said about prevention, which is a multi-layered, comprehensive process, the hallmark of which is vaccination. Now, one of the questions that Dr. Walensky and I and Dr. Murthy and others get asked very frequently is that right now, as we get to the Christmas holiday and the New Year's, would it be safe for individuals who are vaccinated, who are boosted, to get together with family in the setting of the home? The answer to that is yes. An extra level of protection would be the testing that Dr. Walensky measured. But I want to make sure this is not confused with going to a large gathering. And there are many of these parties that have 30, 40, 50 people in which you do not know the vaccination status of individuals. Those are the kind of functions in the context of COVID, and particularly in the context of Omicron, that you do not want to go to. So to the extent possible, we urge you to stay away from those situations that could put you at a higher risk.